Nursing Board Important Question and Answers. 1. The daughter of a client with Alzheimer's disease becomes frustrated when talking to her father. What should a nurse suggest to improve communication? E. Answer his questions simply even if the question is asked repeatedly. B. Finish his sentences before he becomes agitated. C. Focus the conversation on future events. D. Play word games to stimulate his mind and slow progression of the disease. Answer. A. Answer his questions simply even if the question is asked repeatedly. Rationale. The client with Alzheimer's disease typically has lost short-term memory. Understanding of the father's disease will decrease the daughter's frustration. 2. Which suggestion would be most accurate for a nurse to make to the family of a client who has Alzheimer's disease? E. Be sure to correct the client if the client is experiencing delusions. B. Avoid getting upset in front of the client. C. Repeat requests to the client in order to increase compliance. D. Activities should be done quickly to reduce client anxiety. Answer. B. Avoid getting upset in front of the client. Rationale. If the family becomes upset and angry, the client's agitation and anxiety will likely increase. 3. A family member asks a nurse about possible treatments for Stage II Alzheimer's disease. Which statement by the nurse is correct? E. High doses of vitamin E may slow disease progression. B. The benefits of NSAIDs have been proven. C. The risks of herbals, such as ginkgo biloba, are greater than any benefit. D. Recent research has shown hormone replacement improves cognition. Answer. C. The risks of herbals, such as ginkgo biloba, are greater than any benefit. Rationale. Families are often desperate to find a treatment, and there may be serious side effects. They need to discuss alternative therapies with the physician. 4. Which assessment findings are consistent with a diagnosis of Alzheimer's disease? Select all that apply. E. Remote and recent memory impairment. B. No memory impairment but the client is unable to recognize familiar persons. C. Cognitive decline has been rapid. D. B12 deficiency or thyroid disease is often present. Answer. A. Remote and recent memory impairment. Rationale. There is recent and remote memory impairment, as well as anomia, agnosia, and aphasia. 5. A 76-year-old client with hypertension, type 2 diabetes, and a known allergy to seafood is scheduled for a cardiac catheterization. Which orders should a nurse recognize as appropriate for this client? Select all that apply. A. Administration of methylprednisolone. B. Draw blood for a liver panel. C. Draw blood for a renal panel. D. Start ENS IV at 125 ml per hour. Answer. A. Administration of methylprednisolone. Rationale. Antihistamines may be ordered before the procedure because of the known allergy to seafood. 6. A home health nurse is visiting an older client. The client asks the nurse about splitting the simvastatin tablet that has been ordered. Which response should client teaching include? E. All medications can be split safely. B. Let the pharmacy split an extended release tablet. C. Wash and dry the tablet splitting device after each use. D. If the drug is enteric coated, splitting changes the therapeutic response. Answer. C. Wash and dry the tablet splitting device after each. If splitting can be done, an approved device should be used. Clean between usages. 7. A home health nurse is making a follow-up visit to an older adult following discharge from a hospital. Which action by the nurse is most important regarding medication administration in the home setting? E. Give the ordered medication during the while. B. Provide comprehensive teaching. C. Count the number of pills remaining. D. Prepare a list of medications for client. Answer. B. Provide comprehensive rationale. Effectiveness of the discharge orders will depend on the client understanding the regimen. 8. A nursing priority when administering a blood transfusion is to E. Check the fibrinogen level before infusing. B. Infuse blood slowly the first 20 minutes. C. Warm the blood prior to administration. D. Infuse the blood over 1 to 2 hours. Answer. B. Infuse blood slowly the first 20 minutes. A hemolytic reaction will most likely occur during the first 20 minutes. 9. Blood sugar management for a client who has type 2 diabetes with nausea and decreased appetite should include E. Continuing insulin even if the client is vomiting. B. Continuing insulin if blood sugar is less than 80 mg per deciliter. C. Stopping insulin until the client is able to tolerate food. D. None of the above. Answer. A. Continuing insulin even if the client is vomiting. Rationale. During illness the cells still need insulin. Failure to give it will likely put the client into a hyperosmolar, if non-ketotic state. Since the client will not be eating very much, the insulin dose may be reduced, and it is hard to predict by how much. Clients with diabetes need to prepare a sick day strategy, which will include checking blood sugar, and possibly ketone level, more frequently. 10. Which finding indicates that epoetin alpha has been effective? E. Negative hormone sign, up of 35 to 55. B. Guaiac negative gastric secretions and stool. C. Hematocrit of 33%. D. Creatinine of 1.4. Answer. C. Hematocrit of 33%. Rationale. Epoetin alpha stimulates the development of red blood cells. It is given to anemic clients to increase hematocrit. 11. The parents of a child recently diagnosed with cerebral palsy ask the nurse about the disorder. The nurse bases the response on the understanding that cerebral palsy is which type of condition. E. An infectious disease of the central nervous system. B. An inflammation of the brain as a result of a viral illness. C. A congenital condition that results in moderate to severe retardation. D. A chronic disability characterized by impaired muscle movement and posture. Answer. D. A chronic disability characterized by impaired muscle movement and posture. Rationale. Cerebral palsy is a chronic disability characterized by impaired movement and posture resulting from an abnormality in the extrapyramidal or pyramidal motor system. Meningitis is an infectious process of the central nervous system. Encephalitis is an inflammation of the brain that occurs as a result of viral illness or central nervous system infection. Down syndrome is an example of congenital condition that results in moderate to severe retardation. 12. The nurse notes documentation that a child with meningitis is exhibiting a positive Kernig sign. Which observation is characteristic of this sign? E. The child complains of muscle and joint pain. B. Petechial and purpuric rashes are noted on the child's trunk. C. Neck flexion causes adduction and flexion movements of the lower extremities. D. The child is not able to extend the leg when the thigh is flexed anteriorly at the hip. Answer. D. The child is not able to extend the leg when the thigh is flexed anteriorly at the hip. Rationale. Meningitis is an infectious process of the central nervous system caused by bacteria and viruses. The inability to extend the leg when the thigh is flexed anteriorly at the hip is a positive Kernig sign, noted in meningitis. Muscle and joint pain is characteristic of meningococcal infection and H. influenzae infection. A petechial or purpuric rash is characteristic of meningococcal infection. A positive Brudzinski sign is noted when neck flexion causes adduction and flexion movements of the lower extremities in children and adolescents. This is also a characteristic of meningitis. 13. A mother arrives at an emergency department with her 5-year-old child and states that the child fell off a bunk bed. A head injury is suspected, and the nurse checks the child's airway status and assesses the child for early and late signs of increased intracranial pressure, which is a late sign of increased ICP. E. Nausea. B. Irritability. C. Headache. D. Bradycardia. Answer. D. Bradycardia. Rationale. Head injury is the pathological result of any mechanical force to the skull, scalp, meninges, or brain. A head injury can cause bleeding in the brain and result in increased intracranial pressure. In a child, early signs include a slight change in level of consciousness, headache, nausea, vomiting, visual disturbances, seizures. Late signs of increased ICP include a significant decrease in level of consciousness, bradycardia, decreased motor and sensory responses, alterations in pupil size and reactivity, posturing, Cheney-Stokes respirations, and coma. 14. The nurse is assigned to care for an year-old child with a diagnosis of a basilar skull fracture. The nurse reviews the healthcare provider's prescriptions and should contact the HCP to question which prescription. E. Suction is needed. B. Obtain daily weight. C. Provide clear liquid intake. D. Maintain a patent intravenous line. Answer. A. Suction is needed. Rationale. A basilar skull fracture is a type of head injury. Nasotracheal suctioning is contraindicated in a child with a basilar skull fracture. Because of the nature of the injury, there is a possibility that the catheter will enter the brain through the fracture, creating a high risk of secondary infection. Fluid balance is monitored closely by daily weight determination, intake and output measurement, and serum osmolality determination to detect early signs of water retention, excessive dehydration, and states of hypertonicity or hypotonicity. The child is maintained on NPO status or restricted to clear liquids until it is determined that vomiting will not occur. An intravenous line is maintained to administer fluids or medications if necessary. 15. The nurse is reviewing the record of a child with increased intracranial pressure and notes that the child has exhibited signs of decerebrate posturing. On assessment of the child, the nurse expects to note which characteristic of this type of posturing. E. Flaccid paralysis of all extremities. B. Adduction of the arms at the shoulders. C. Rigid extension and pronation of the arms and legs. D. Abnormal flexion of the upper extremities and extension and adduction of the lower extremities. Answer. C. Rigid extension and pronation of the arms and legs. Rationale. Decerebrate posturing is characterized by the rigid extension and pronation of the arms and legs. Option 1 is incorrect. Options 2 and 4 describe decorticate posturing. 16. A child is diagnosed with Reye syndrome. The nurse develops a nursing care plan for the child and should include which intervention in the plan? E. Assessing hearing loss. B. Monitoring urine output. C. Changing body position every 2 hours. D. Providing a quiet atmosphere with dimmed lighting. Answer. D. Providing a quiet atmosphere with dimmed lighting. Rationale. Reye syndrome is an acute encephalopathy that follows a viral illness and is characterized pathologically by cerebral edema and fatty changes in the liver. A definitive diagnosis is made by liver biopsy. In Reye syndrome, supportive care is directed toward monitoring and managing cerebral edema. Decreasing stimuli in the environment by providing a quiet environment with dimmed lighting would decrease the stress on the cerebral tissue and neuron responses. Hearing loss and urine output are not affected. Changing the body position every 2 hours would not affect the cerebral edema directly. The child should be positioned with the head elevated to decrease the progression of the cerebral edema and promote drainage of cerebrospinal fluid. 17. The nurse develops a plan of care for a child at risk for tonic-clonic seizures. In the plan of care, the nurse identifies seizure precautions and documents that which item need to be placed at the child's bedside. E. Emergency card. B. Tracheotomy set. C. Padded tongue blade. D. Suctioning equipment and oxygen. Answer. Laughing face, suctioning equipment and oxygen. Rationale. A seizure results from the excessive and unorganized neuronal discharges in the brain that activate associated motor and sensory organs. A type of generalized seizure is a tonic-clonic seizure. This type of seizure causes rigidity of all body muscles, followed by intense jerking movements. Because increased oral secretions and apnea can occur during and after the seizure, oxygen and suctioning equipment are placed at the bedside. A tracheotomy is not performed during a seizure. No object, including a padded tongue blade, is placed into the child's mouth during a seizure. An emergency cart would not be left at the bedside, but would be available in the treatment room or nearby on the nursing unit. 18. A lumbar puncture is performed on a child suspected to have bacterial meningitis, and cerebrospinal fluid is obtained for analysis. The nurse reviews the results of the CSF analysis and determines that which results would verify the diagnosis. E. Clear CSF, decreased pressure, and elevated protein level. B. Clear CSC, elevated protein, and decreased glucose levels. C. Cloudy CSF, elevated protein, and decreased glucose levels. D. Cloudy CSF, decreased protein, and decreased glucose levels. Answer. C. Cloudy CSF, elevated protein, and decreased glucose levels. Rationale. Meningitis is an infectious process of the central nervous system caused by bacteria and viruses. It may be acquired as a primary disease or as a result of complications of neurosurgery, trauma, infection of the sinus or ears, or systemic infections. Meningitis is diagnosed by testing cerebrospinal fluid obtained by lumbar puncture. In the case of bacterial meningitis, findings usually include an elevated pressure, turbid or cloudy cerebrospinal fluid, an elevated leukocyte, elevated protein, and decreased glucose levels. 19. The nurse is planning care for a child with acute bacterial meningitis. Based on the mode of transmission of this infection, which precautionary intervention should be included in the plan of care? E. Maintain enteric precautions. B. Maintain neutropenic precautions. C. No precautions are required as long as antibiotics have been started. D. Maintain respiratory isolation precautions for at least 24 hours after the initiation of antibiotics. Answer. Laughing face. Maintain respiratory isolation precautions for at least 24 hours after the initiation of antibiotics. Rationale. Meningitis is an infectious process of the central nervous system caused by bacteria and viruses. It may be acquired as a primary disease or as a result of complications of neurosurgery, trauma, infection of the sinus or ears, or systemic infections. A major priority of nursing care for a child suspected to have meningitis is to administer the antibiotic as soon as it is prescribed. The child also is placed on respiratory isolation precautions for at least 24 hours while culture results are obtained and the antibiotic is having an effect. Enteric precautions and neutropenic precautions are not associated with the mode of transmission of meningitis. Enteric precautions are instituted when the mode of transmission is through the gastrointestinal tract. Neutropenic precautions are instituted when a child has a low neutrophil count. 20. An infant with a diagnosis of hydrocephalus is scheduled for surgery. Which is the priority nursing intervention in the preoperative period? E. Test the urine for protein. B. Reposition the infant frequently. C. Provide a stimulating environment. D. Assess blood pressure every 15 minutes. Answer. B. Reposition the infant frequently. Hydrocephalus occurs as a result of an imbalance of cerebrospinal fluid absorption or production that is caused by malformations, tumors, hemorrhage, infections, or trauma. It results in head enlargement and increased intracranial pressure. In infants with hydrocephalus, the head grows at an abnormal rate, and if the infant is not repositioned frequently, pressure ulcers can occur on the back and side of the head. An egg crate mattress under the head is also a nursing intervention that can help prevent skin breakdown. Proteinuria is not specific to hydrocephalus. Stimulus should be kept at a minimum because of the increase in intracranial pressure. It is not necessary to check the blood pressure every 15 minutes. 21. The nurse is developing a plan of care for a child who is at risk for seizures. Which interventions apply if the child has a seizure? Select all that apply. E. Time the seizure. B. Stay with the child. C. Move furniture away from the child. D. All the above. Answer. D. All the above. Rationale. A seizure is a disorder that occurs as a result of excessive and unorganized neuronal discharges in the brain that activate associated motor and sensory organs. During a seizure, the child is placed on his or her side in a lateral position. Positioning on the side prevents aspiration because saliva drains out the corner of the child's mouth. The child is not restrained because this could cause injury to the child. The nurse would loosen clothing around the child's neck and ensure a patent airway. Nothing is placed into the child's mouth during a seizure because this action may cause injury to the child's mouth, gums, or teeth. The nurse would stay with the child to reduce the risk of injury and allow for observation and timing of the seizure. 22. A child has a right femur fracture caused by a motor vehicle crash and is placed in skin traction temporarily until surgery can be performed. During assessment, the nurse notes that the dorsalis pedis pulse is absent on the right foot. Which action should the nurse take? A. Administer an analgesic. B. Release the skin traction. C. Apply ice to the extremity. D. Notify the healthcare provider. Answer. D. Notify the healthcare provider. Rationale. Scoliosis is a three-dimensional spinal deformity that usually involves lateral curvature, spinal rotation resulting in rib asymmetry, and hypokyphosis of the thorax. A complication after surgical treatment of scoliosis is superior mesenteric artery syndrome. This disorder is caused by mechanical changes in the position of the child's abdominal contents, resulting from lengthening of the child's body. The disorder results in a syndrome of emesis and abdominal distension similar to that which occurs with intestinal obstruction or paralytic ileus. Postoperative vomiting in children with body casts or children who have undergone spinal fusion warrants attention because of the possibility of superior mesenteric artery syndrome. Options 1, 2, and 3 are incorrect. 23. The nurse is providing instructions to the parents of a child with scoliosis regarding the use of a brace. Which statement by the parents indicates a need for further instruction? A. I will encourage my child to perform prescribed exercises. B. I will have my child wear soft fabric clothing under the brace. C. I should apply lotion under the brace to prevent skin breakdown. D. Should avoid the use of powder because it will cake under the brace. Answer. C. I should apply lotion under the brace to prevent skin breakdown. Rationale. A brace may be prescribed to treat scoliosis. Braces are not curative, but may slow the progression of the curvature to allow skeletal growth and maturity. The use of lotions or powders under a brace should be avoided because they can become sticky and cake under the brace, causing irritation. Options 1, 2, and 4 are appropriate interventions in the care of a child with a brace. 24. The nurse is assisting a healthcare provider examining an infant with developmental dysplasia of the hip perform an Ortolani maneuver. The nurse understands that this maneuver is performed for which purpose? A. To assess for hip instability. B. To assess for movement of the hip. C. To push the femoral head out of the acetabulum. D. To ensure that hyperextension and full range of motion exist. Answer. A. To assess for hip instability. Rationale. In developmental dysplasia of the hip, the head of the femur is seated improperly in the acetabulum or hip socket of the pelvis. Ortolani's maneuver is a test to assess for hip instability. The examiner abducts the thigh and applies gentle pressure forward over the greater trochanter. A. Clicking sensation indicates a dislocated femoral head moving into the acetabulum. This maneuver does not assess for hip movement or ensure that hyperextension and full range of motion exist. Pushing the femoral head out of the acetabulum is not the purpose of Ortolani's maneuver. 25. A 1-month-old infant is seen in a clinic and is diagnosed with developmental dysplasia of the hip. On assessment, the nurse understands that which findings should be noted in this condition. A. Limited range of motion in the affected hip. B. An apparent lengthened femur on the affected side. C. Asymmetrical adduction of the affected hip when the infant is placed supine with the knees and hips flexed. D. Symmetry of the gluteal skin falls when the infant is placed prone and the legs are extended against the examining table. Answer. A. Limited range of motion in the affected hip. Rationale. In developmental dysplasia of the hip, the head of the femur is seated improperly in the acetabulum or hip socket of the pelvis. Asymmetrical and restricted abduction of the affected hip, when the child is placed supine with the knees and hips flexed, would be an assessment finding in developmental dysplasia of the hip in infants beyond the newborn period. Other findings include an apparent short femur on the affected side, asymmetry of the gluteal skin folds, and limited range of motion in the affected extremity. 26. Parents bring their 2-week-old infant to a clinic for treatment after a diagnosis of clubfoot made at birth. Which statement by the parents indicates a need for further teaching regarding this disorder? A. Treatment needs to be started as soon as possible. B. I realize my infant will require follow-up until fully grown. C. I need to bring my infant back to the clinic in 1 month for a new cast. D. I need to come to the clinic every week with my infant for the casting. Answer. C. I need to bring my infant back to the clinic in 1 month for a new cast. Rationale. Clubfoot is a complex deformity of the ankle and foot that includes forefoot adduction, midfoot supination, hindfoot varus, and ankle equinus. The defect may be unilateral or bilateral. Treatment for clubfoot is started as soon as possible after birth. Serial manipulation and casting are performed at least weekly. If sufficient correction is not achieved in 3 to 6 months, surgery usually is indicated. Because clubfoot can recur, all children with clubfoot require long-term interval follow-up until they reach skeletal maturity to ensure an optimal outcome. 27. The nurse prepares a list of home care instructions for the parents of a child who has a plaster cast applied to the left forearm. Which instructions should be included on the list? Select all that apply. E. Keep small toys and sharp objects away from the cast. B. Elevate the extremity on pillows for the first 24 to 48 hours after casting to prevent swelling. C. Contact the healthcare provider if the child complains of numbness or tingling in the extremity. D. All the above. Answer. D. All the above. Rationale. While the cast is drying, the palms of the hands are used to lift the cast. If the fingertips are used, indentations in the cast could occur and cause constant pressure on the underlying skin. Small toys and sharp objects are kept away from the cast, and no objects are placed inside the cast because of the risk of altered skin integrity. The extremity is elevated to prevent swelling, and the HCP is notified immediately if any signs of neurovascular impairment develop. A heating pad is not applied to the cast or fingers. Cold fingers could indicate neurovascular impairment, and the HCP should be notified. 28. An infant of a mother infected with HIV is seen in the clinic each month and is being monitored for symptoms indicative of human immunodeficiency virus infection. The nurse assesses the infant, knowing that which infection is the most common opportunistic infection of children infected with HIV. A. Meningitis. B. Gastroenteritis. C. Cytomegalovirus infection. D. Pneumocystis jirovecii pneumonia. Answer. Laughing face. Pneumocystis jirovecii pneumonia. Rationale. AIDS is a disorder caused by HIV and characterized by generalized dysfunction of the immune system. The most common opportunistic infection of children infected with HIV is P. jirovecii pneumonia, which occurs most frequently between the ages of 3 and 6 months, when HIV status may be indeterminate. Cytomegalovirus infection is also characteristic of HIV infection, however, it is not the most common opportunistic infection. Although neurological abnormalities and gastrointestinal disturbances may occur in a child with HIV infection, options 1 and 2 are not specific opportunistic infections noted in the HIV-infected child. 29. The nurse provides home care instructions to the parent of a child with acquired immunodeficiency syndrome. Which statement by the parent indicates the need for further teaching? A. I will wash my hands frequently. B. I will keep my child's immunizations up to date. C. I will avoid direct unprotected contact with my child's body fluids. D. I can send my child to daycare if he has a fever, as long as it is a low-grade fever. Answer. D. I can send my child to daycare if he has a fever, as long as it is a low-grade fever. Rationale. AIDS is a disorder caused by HIV and characterized by generalized dysfunction of the immune system. A child with AIDS who is sick or has a fever should be kept home and not brought to a daycare center. Options 1, 2, and 3 are correct statements and would be actions a caregiver should take when the child has AIDS. 30. The clinic nurse is instructing the parent of a child with human immunodeficiency virus infection regarding immunizations. The nurse should provide which instruction to the parent? A. The hepatitis B vaccine will not be given to the child. B. The inactivated influenza vaccine will be given yearly. C. The varicella vaccine will be given before 6 months of age. D. A Western blot test needs to be performed and the results evaluated before immunizations. Answer. B. The inactivated influenza vaccine will be given yearly. Rationale. Immunizations against common childhood illnesses are recommended for all children exposed to or infected with HIV. The inactivated influenza vaccine that is given intramuscularly will be administered. The hepatitis B vaccine is administered according to the recommended immunization schedule. Varicella zoster virus vaccine should not be given because it is a live virus vaccine. Varicella zoster immunoglobulin may be prescribed after chickenpox exposure. Option 4 is unnecessary and is inaccurate. Thank you.